Welcome, everyone. Today, we're going to shed light on a very common yet often misunderstood issue, and this is thrush, also known as a yeast infection. So, we will discuss the causes, the symptoms, and effective treatment for this fungal infection. So, whether you're looking for preventative strategies or you're seeking guidance on managing the symptoms, we'll be here for very candid discussion on thrush and, of course, its impact on your health. So just to start with, what exactly is thrush? How would you define a thrush step?
Yeah. So let me just start off with, as Trudy mentioned, it's a yeast infection. So which means that's caused by yeast. So this yeast is, it normally exists like naturally in our bowel and in the vaginal area, but it exists in small numbers. So in thrush, what happens is that there's an overgrowth of this yeast, which in the technical terms is called Candida albicans. And in thrush, because we have an overgrowth of this yeast, it tends to give us the symptoms of thrush. So on a normal basis, we have that, and it doesn't really cause any symptoms. But then when there's an increase of it, that's when we start to develop these symptoms. So it can be caused by different things. So, with the thrush symptoms, it normally causes basically discomfort in the vaginal area. So you may have like redness or a bit of itchiness or a bit of burning sensation down there. Most of the time with thrush, it does cause a bit of discharge, but this discharge is usually like a white discharge. And that's what normally tells us that, okay, this is thrush. So I'm talking about the vaginal thrush here. And sometimes when you urinate, you may find that it's causing a bit of like burning sensation around that area as well. And some people may find a bit of discomfort as well, like during sex when they have thrush. So this is the vaginal thrush. There are different thrush as well that does this. So some thrush can also occur in your mouth, in your armpit, in your toes. But for today, we're just going to be focusing on the vaginal thrush. So as I mentioned, you get these symptoms, and that's what tells you that, okay, this is vaginal thrush, because there are different things that affects that causes some burning sensations as well. But then when you have that white discharge, that's when you know, yes, this is vaginal thrush. As I mentioned, it can be caused by different things. And Trudy, what things can cause the vaginal thrush?
So there is a lot of factors that can contribute to sort of developing thrush. As you said, it is something that's naturally occurring in our body that kind of causes some of these symptoms. When you have overgrown of yeast, which causes thrush. But if you have certain factors or certain, say, conditions or things like that, it could actually contribute to developing of thrush. So if you have a weakened immune system, so having conditions or medications that weaken the immune system, like HIV or AIDS or cancer, being on cancer treatments, or if you're on steroids, that can actually increase candida overgrowth and hence, of course, increase the chances of you having thrush. Also, what we find out is if you're on, say, antibiotic medication, so antibiotics can actually disrupt the balance of the microorganisms in the body. Therefore, this imbalance can allow the candida to multiply faster than it normally would, and this will lead to thrush. Also, conditions like diabetes, so poorly controlled diabetes can actually create an environment conducive for yeast overgrowth, therefore causing thrush. Hormonal changes, are also very, very common in being one of the factors that can lead to thrush. And this is why we are going to focus on vaginal thrush today, only because it actually affects more women than men. So it is predicted that about 75% of women will have thrush at some point in their life. So
Yeah.
it is it is something that will affect a lot of women. And of course, this is because of the hormonal changes in the body that could cause thrush. Now,
Yeah.
as we said earlier, use of steroids can cause can be a factor that contribute to causing thrush, but also inhalers and things like that. You
Okay.
know, that might not necessarily be vaginal thrush, but that can actually cause oral thrush because
Oh,
of the, as we said,
yes.
the way the steroids will work. They will cause an imbalance in the microorganisms in
Yeah.
in the mouth and the in the body, and of course this will potentially lead to in this case, if it's like inhalers, oral thrush.
Yeah.
So also it's actually known that high foods in high sugars, so high
Mm.
sugar diets can actually increase the likelihood of you having thrush, because
Yeah.
what sugar does, it actually promotes the growth of yeast. So cutting down on things like this could actually reduce the prevalence of thrush.
Yeah.
You did mention, Stephanie, the signs
Mm.
and symptoms. Now, you mentioned a discharge. What
Yes.
discharge are we looking at? Because let's just be very candid here. As women, we will have some discharge every now
Yes.
and then. And that is, first of all, that is very normal.
Yeah.
To have a discharge doesn't mean you're dirty. It doesn't mean
That's right.
something is wrong, because
Mm.
that's, I don't know about you, Steph, but growing up, it was like,
Yeah.
there was girls talking, they're like, oh, like
I
discharge, oh, that's
know.
dirty. You're not very clean,
Yeah.
kind of thing. Not that we were showing each other what's going on, but it's like, talking about it. They're like, oh, but
Yeah.
first of all, discharge is normal, right?
Yes.
What
Mm-hmm.
discharge step are we looking at when it comes to thrush?
Yeah.
And how can I now, if as a woman we're having a discharge every
Mm.
so often every day, how am I
Yeah.
going to know this is a discharge
That's
that
right.
could be thrush?
Yeah, that's right. I'm so glad you brought this up. Like, actually, as you said, yeah, like as girls, yeah, when you're talking, you're like,
Yeah.
oh, I've got discharge, like, and then people start to act a bit funny and things.
Yeah.
I mean, like, when we're growing up, I think loads of people didn't want to talk about it, but it was really
Mm-hmm.
common amongst us. Like,
Yeah.
as girls, you do produce discharge, like, as a
Mm-hmm.
not like normally. That's why sometimes, you wear panty liners just to help
Mm-hmm.
with that. So
Yeah.
on the normal basis, like this discharge is light, right?
Mm-hmm.
But with vaginal thrush, the discharge is thick. They
Mm-hmm.
usually refer it as like cottage cheese.
Mm-hmm.
Yes, because of how thick it is. It's like a thick
Mm-hmm.
white discharge.
Mm-hmm.
And the appearance of it is like yeast, but sometimes it may come with or without a smell when it comes to like the thrush. That's one thing about it. But the difference, like with the normal discharge and the vaginal discharge, is just the thickness of it. Like with the normal discharge, it's not that thick, but with thrush, it is very thick. It is very thick, and you will notice that no, this is not like my normal discharge. And and also you like, as you were talking about as girls, and talking about it being a bit of like something a no topic. It's something that, when I was growing up here, my parents used to, well, not my parents, my mum used to say, oh, if you eat too much sweets, you're going to get something called white. And they meant vaginal thrush. They used to call it white
White.
because because of the discharge,
Yes.
basically. So they
Do you
used to
know
call
what?
it.
I like that. I'm gonna, when I have children and when I have a daughter, I'm like, listen, you keep up
Yes.
those sweets because white is real.
Listen, yeah, that's what, like, in my household, yeah, that's what they used to call it. Like, I remember, I had like one of my relative, and she kept on getting like thrush a lot of times. So she came to me, she was like, oh, I keep getting white. And I was like, oh dear, this is caught on.
Them sweets you've been eating.
This is caught on, like everyone is calling it white. And I was like, okay. And I was like, okay. I was just looking at her and I was like, you know, using my knowledge, I said, this girl, eats so much sweet. It is unbelievable. So one day we were just like, you know, the way she keeps getting thrashier, let's just check her sugar levels. I kid you not, Trudy, when they checked her sugar levels, a young girl, listen, I am older than this girl, this young girl, her sugar level was off the roof. I'm not kidding.
God. And that's why it's important, actually. And you know, it's good we're talking about this. Because you don't realize how much diet contributes to a lot of things, and also preventing a lot of things. So knowing that, okay, too much sweet is actually a thing, even as parents, you know, young parents don't necessarily know some of these things, you know. So you don't realize what you're giving to a child, or what you're allowing them to ingest. Oh, poor girl.
No, honestly, but it was a good thing we checked it, and I'm not gonna lie, since we checked it, like her sugar levels have been going down, so her recurrent thrush is also going down. But it was just the way, like, she came, oh, I've got white. I'm like, oh my gosh, our parents' terminology is actually living on amongst us.
I think it's, do you know what? I think first of all, it's because, you know, African parents, they something don't say out. You can't just go to a shop and say, right, you know, time for white. Okay. So
honestly,
respect to them, respect.
But I think
it's also very important. I think also noting that while thrush is common, some of these symptoms can also be indicative of other conditions. So if you're not sure, just because you have maybe some of these symptoms and signs that we've talked about, it doesn't necessarily mean it is thrush. So if you suspect, say, you have one of these symptoms, it's the first time, you're not quite sure what it is, it's very advisable to seek medical advice just for accurate diagnosis and appropriate treatment.
That's right. That's right. Yeah.
Talking of treatment, what is a treatment for thrush?
For thrush. So with thrush, because it's so common, you could get some treatment over the counter. You go to your local chemist and, you know, just let them know that, you know, you're getting these symptoms, and they would, you know, make that diagnosis that, yes, you've got thrush. So it usually comes as, so we have different things you can use. So we have the antifungal creams, or we have like something called vaginal tablets, which we call pessaries. So these contain the antifungal in there, you know, because the yeast infection is a fungal infection. So these antifungal basically tackle the yeast to reduce the numbers of them. So that's why we use them. So normally with the vaginal pessaries and creams, they usually the creams comes with like a special applicator where, you know, you use it, and it normally is we use it from like 1 to 7 days, because with thrush and we normally say it should start to go away between 7 to 14 days. So depending on the product, you should use it 1 to 7 days. And one thing we need to know is that some of these topical treatments, the creams, they can weaken condoms. So if you are someone that is having sex whilst you have thrush, I would suggest you apply the creams after sex, because that means that, you know, when it weakens the condom, you're not really protected. So please bear that in mind. So if you are using these topical treatment like the creams, the pessaries, just bear that in mind. They can weaken the condoms. There is also some oral treatments as well, which is the fluconazole. So it usually comes as a 150 milligram single dose, which you do take. It is quite like it's as effective as the cream, and the applicators as well. The pessaries is as effective as them. But the thing about the tablet is that it's a lot more expensive than the creams, I would say. So
Mm-hmm.
you just need to weigh your option and just use the creams and the pessaries. If you feel maybe they're not working for you, maybe you may opt for the tablets instead. But always speak to your pharmacist when it comes to treatment, so that they could provide you with the right information so that you make your choices.
True.
Yeah, and if you are on any medication as well, do let them know, because these are antifungals, so maybe sometimes they may interact with some of your medications. So do let them know which medications you are taking before
Mm-hmm.
they provide you with this medication. Yeah. Um, so before we move on, I wanted to check, Trudy, with thrush, sometimes some people can have the misconception that, it is an STI. Um, w- can you provide us with the right information, and does it also affect like men?
So there is a lot of myths and misconceptions when in
Yeah.
regards to thrush or white, as some people call it. So
Yes.
there is, as I said, literally a lot of myths, and
Mm,
one of them is what you've mentioned. People say that thrush is a sexually transmitted disease or infection,
yeah.
but this is actually not correct. The yeast causing thrush is naturally present in the body.
Mm,
Well, of course, sexual activity, so like sex, can be a
mm,
factor that can sort of like cause, because of, I suppose, with imbalance and all of that, and also just irritation down there. It can't cause it to just sort of it can basically be a factor that contributes to it happening. It is not really classed as an SDI. So
yeah.
it is actually one of the fewer sort of conditions that is very common in women that is actually not even classed as an STI. Hence why
Yeah.
it is something that almost pretty much 3/4 of women will have it, because it's just something that's naturally occurring. It's not something
Yeah.
we can control. So no, it is definitely not an STI.
Yeah.
That is a no.
Brilliant, brilliant. Yeah, I'm so glad you said that, because sometimes, when things are happening in the genital area, automatically
Mhm.
people assume, oh, it's an STI. But
Yeah.
no, as you mentioned, it's not an STI. But
Yeah.
one thing that people need to be aware, let's say, for instance, you do have thrush as a woman and you do have sex. Sometimes that could irritate like the man's
Yeah.
penis, where they may have like redness and a bit of like irritation to like the head
Mhm.
of the penis. So that's why
Mhm.
some women often avoid sex when they have thrush, just to prevent this discomfort for the men. But thrush
Mhm.
is also common in men. Like, yeah, it's not just to women. Some men
Yeah.
may have it. Yeah, that's one
I'm
thing.
I'm glad you
Yeah,
mentioned something though, Steph. You did
yeah,
say that in regards to say treatment, and I'm going back
yeah,
onto this point just so we finish talking about treatment. So in
yes,
regards to treatment, of course, women can use all these things, right?
yes.
But I think we should just very briefly talk about who cannot use it. So women can use it,
Oh,
but
yes.
can all women use it? Women of all ages, because
Mm,
what the reason I say this is I decline a lot of older women.
okay. Who do
From
you decline?
so women, we know that thrush treatment, as much as it can be used for any sort of like confirmed thrush infections, not everyone is
Mm,
suitable for it. Just like any other medication, not
yeah,
every person will be suitable for certain medication, right? So there is certain
yes,
groups of people that if they come to me and we're just sort of like talking through it, and normally I ask a few questions, like first of all, how long has this been going on? Have you
yeah.
had this before? Things like that. Now, if a woman says to me, for instance, that they've never had it, I
Mm,
would actually refer them to the doctors or refer them for just a check,
mm,
right? Just because it could be something completely different. It could be something underlying as well.
Yes.
So again, it is one of those, if they have already confirmed that it is thrush, there could be
Mm-hmm.
that leeway where I can be like, okay, that's fine, we'll go with this treatment and see how that
Yes.
goes. Maybe we'll go with a cream and see how that goes to start with.
Mm.
But say children under 16,
Yes.
I always refer to the doctors, because
Mm.
for infants and say young children, especially those under 16, it's just
Yes.
advisable to consult, say, a doctor before
Mm.
buying any over-the-counter thrush treatments. Because,
Yes.
say, for like, and we mentioned, these things like oral thrush, it can actually affect little girls, but even thrush
Mm.
can actually affect young girls, very young girls. So
That's
for
true.
treatments for these kind of groups, they might be sort of they might need alternative treatments. So
Mm.
it's just best to just refer them to the doctor, based on, of course, the child's
Yes.
health and health status, just for them to get that extra check.
Yes. Yes.
Hmm.
Yes. 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 Brilliant. Yeah. And I think even like with patients that have had like thrush more than twice in like 6 months as well,
Yes.
it's best to refer them to the
Hmm.
doctor. Yeah.
Hmm.
Um, let's say, for instance, it's a male and they're having like abnormal discharge as well. It's
Hmm.
best, like, you go to your doctor as well. Any
Yeah.
like blisters or sores around the vagina area, like,
Hmm.
the doctor, yeah, so that
Yeah.
they'll have a look at
And
it.
also
Yeah.
women of a certain age, so women over 60 as well.
60.
Yeah,
Yes.
so those would ideally go to the doctors. Just because, again,
Yes.
I always say, as much as we want to help you over the counter
Yeah.
and want to be the fast point of action before you
Yeah.
seek any other help, we would want you
That's
to be
right.
as safe as possible. So if there's
Yeah.
any tests that need to be done, any extra checks, we would rather
Yeah.
that, because some of the checks we can't do in the pharmacy, unfortunately. We
That's
don't have
right.
some of the,
That's
facilities to do
right.
some of these tests.
Yeah. And we're not saying that, like, there's no treatment for these age groups as well. I mean,
Yeah.
like, I have come across like some older women who maybe they've been using some, let's say, for instance, maybe they're diabetic or they're on HRT, so which makes them prone to getting a thrush.
Yeah.
So with these patients, they have actually seen their doctor, and the doctor has given them maybe these products to use. We're not saying that there's no medications for you, but it's best to go to a doctor so that they'll be like, they'll rule out like what's causing your thrush, and they'll be like, okay,
Hmm.
yeah, this is fine for you to take. Trust
Yeah.
me, I have come across like all the patients who need like antifungal creams and stuff because they have thrush. So, yeah,
Yeah. And we're
no
only
problem.
sending you to your doctors just so they can
Yeah,
see what is actually causing the thrush.
that's
Could there be,
right.
because you don't want to just cover up something,
Yes,
you want to get treatment and you want to actually identify what could be causing it. Maybe try avoid it, maybe try work around it.
yes,
That's why we're referring you to the doctors, because we can do all these checks just to make sure that, okay, it's not just, you know, just thrush is being caused by sort of overgrowth
yes,
of candida, but it's actually something about your health or your medication maybe, or maybe even your period that could be causing your thrush. So it's
that's
basically,
right.
we're not saying we cannot do nothing for you. We would want to,
Yes,
but we want to be as careful here, because
that's
it's your
right.
health we're talking about. We want to be as cautious and as thorough as possible.
Yes, yes,
Now,
brilliant.
going back to myths, Steph, you tell me
Yes,
about your myths, because I have heard a lot when it comes to thrush. And I think
really.
it's because I was a woman growing up with this and
Okay.
it being so common. There's been
Yeah.
so many myths and misconceptions about thrush.
Okay. I mean, as I said, the only myths I heard was like the STI, it
Hmm.
being an STI, and also like maybe not affecting men.
Hmm.
That was like the main myths I used to come across.
Right.
Yeah, I think, as we always say, there's always like a lot of like talks on the internet and stuff. But one thing is that don't listen to these myths. Let me try and think of one. Well, you give us a myth whilst I think of one.
Okay,
Yeah.
we've got this. So, you did ask me something. You said about the myth about men not having thrush. First of
Yes.
all, that is a lie. We have identified that. I think
Yes.
by this point, we have identified that men can also have thrush. It
Yes.
might not be as the same symptoms as
frequent.
there is in women,
Yeah.
but it is similar. It will affect sort of like the man area. So
Yeah.
it will affect the penis, the head of the penis, or
Mm.
if you have, say, foreskin, you might be finding it painful to hold the foreskin forward, because as you
Yeah.
can say, it's that irritation, maybe redness, maybe swelling around that area, right?
Mm.
So men can also get thrush, okay? This is not just something that women can get. Men can also get
Yes.
thrush. Another thing
Yeah.
I've heard is only adults can get thrush,
Oh
because
no.
women come in and they say some of the symptoms. My daughter has been doing this and that and that. I'm like, oh,
Uh,
that could be thrush. She's like, no, I said my daughter. This is a child. How can she be having thrush? And I'm trying to find the best way to break it,
yeah.
down to her that
You
having
see,
thrush. But
yeah.
babies can have thrush,
Yeah.
so it can affect anyone of
Anyone.
any age.
Yes.
It is not, it doesn't pick, it doesn't do this
Yeah.
Passover, child Passover to the woman between, I don't know,
Yeah.
16 and 16. No, it can affect literally anyone.
Anyone. Yeah.
Anyone.
Yeah, it's because, people automatically assume that thrush is like a sexual disease or
That's
something,
it.
but it's not.
It's
That
not.
it's not. Like when they hear thrush or when they hear vaginal thrush, they just think, ah, this girl has been having sex or having too much sex or something like
Sex.
that.
That's it. Yeah.
Let's be honest here. Growing up
Mm-hmm.
here as girls here, that's what we used to think. That's what we never
Mm-hmm.
used to like talk about it, because we used to think, oh, maybe she's having sex, that's why she has thrush. But
That's it.
let's move away from that. Thrush is not caused by like a sexual intercourse or something. It's just
Oh, no,
something
it's
that
not.
happens naturally.
It
That's
is.
why it can happen to anyone, any age. And as
Babies, weeks old,
yes,
to a woman
yeah,
who's 110, or a man who is
honestly,
107.
yeah.
Anyone can have thrush.
Yeah, and as I mentioned, thrush can occur in different places as well. I remember like my babies here when they were born, they had like thrush in their mouth, like just a
Mm-hmm.
little bit. But
Mm-hmm.
I think that was just caused by like the milk they were having or something.
Mm-hmm.
Yeah, and it's normal. A baby can
Yeah.
get it.
Yeah. Yeah.
Yeah,
As we have
you
identified,
know.
it's not caused by anything unnatural. It's just something
Yeah,
natural in our body.
yeah,
The yeast overgrowth. We all have this
that's right.
this natural carrying thing in the body. So if it overgrows and goes past the sort of the limit, it could become thrush. So it is
Yeah,
actually normal, guys. It is a normal thing. Well, it's not normal. It's a something that we need treatment for, but it is
yeah,
normal in the sense that it is
it
not an
occurs.
STI. It's not that
Yeah.
it's not that anyone is doing something wrong. Anyone can get it.
That's right. That's
Yeah.
right. That's right.
Have you
Yeah.
also heard, Steph, when people have said that thrush is always visible, like you'll always see thrush?
Yes, I've heard that, but it's not really visible, I
No.
did say sometimes you will have like thick discharge, but not everyone actually gets it, but they still
No.
have thrush.
Uh-huh.
So it's not really visible.
Uh-huh.
You may have thrush and you may not be getting all these symptoms that we've listed, but you
Yeah.
still have thrush.
Yeah.
So yeah,
Because there's
that
also,
is.
bearing in mind,
Mhm.
there's also like internal thrush. So that's why they say you
Yes,
suppress, or even if it's in the mouth, if
yes,
it's gone sort of down the throat, you will not see it.
that's
So
right.
it's not something that you can say, open your mouth. No, I don't see anything. Let me look at
Yeah.
you down there. No, you look clear. Any
Yeah.
discharge, you're like, no, not anything
Yeah.
unusual. So you basically cancel out,
That's
it
right.
being thrush. No, that is not the case. The
Yeah.
case. It can literally happen in a very symptomatic way, and you
Yeah.
will not even know that it is thrush.
Yeah. Oh, I've just thought of like a myth. So,
Hmm.
sorry, I was just thinking about back in school, like what
Yeah.
people used to say. So, if like let's say for instance you have thrush, you're a bit itchy down there, you're having a bit of discomfort, people just automatically assume that maybe you're unclean.
Hmm.
Does like does having a yeast infection mean that you're unclean? No, that's
No.
one myth. Like I think people need to stop.
Yeah,
it does not mean you're unclean. Like as we said, this is like to do with like overgrowth of the yeast, so it could be
that's it.
caused by different things. So that's one thing I think, especially the young girls, we need to stop saying that, because I think that's
Yes.
one thing we used to tease each other about. Like, you know, when you say you're a bit itchy, oh, oh, you
Yeah.
don't wash yourself, you don't
Yeah.
like,
Don't
you
wash
know.
properly. But
Yes.
having said that, though, Steph,
Mm,
good hygiene is
it's
actually
true.
good for
Yes, yes, yes.
preventing maybe recurrence or even easing some of the symptoms of thrush.
Yes,
So we're not
yes.
saying go out there, girls, you know, whether you're clean or clean or I say girls, but you know, boys can get to and
Yeah.
figure that out. But we're not saying that just get out there, you know, you don't have to clean, you're
Mm,
good. No, make sure you're cleaning, but also make sure you're cleaning down there. All right. Well,
that's right.
you're clean. There's some things that could worsen. If you have thrush, they could worsen how
Yes.
how bad thrush is, or they could really not ease the symptoms of thrush, which we'll probably talk about in just a second. We're not
Mm,
saying do these things, but we're just saying just keep clean either way.
that's
But
right.
if you have thrush, it's not because you're unclean. It's not because you
Yes.
have not washed properly. No, that is definitely a myth.
Yes. Yes.
I think
Yes.
the
Yes.
last myth that I have from my end, and I've heard this before from
Mm,
a lot of women, is natural remedies always cure thrush. They come to me and they're like, "I've got this, I've got this, I've got that," and I'm like, "Oh, that could be thrush." They're like,
mm,
"Oh, I've got a natural remedy that always
yes.
cures it." Well, some natural remedies can do this. They can
Yes.
provide relief for thrush. They're not necessarily guaranteed cures.
That's
Because
right.
we have spoken about sort of like herbal remedies and things like that. And we've said because there's no really any proof, there's
Mm,
not any studies that's been done on herbal remedies, natural remedies. We
yeah.
can't really speak on them in the sense of yes, this has shown to be the cure, unless there's of course any test that's been done.
Yes.
Personally, I will not recommend using natural remedies. You can use
Yeah.
natural remedies to relieve some of the symptoms of thrush,
Yeah.
but to cure it, I have questions. So,
Okay.
antifungal treatment definitely would cure and treat fungal
Yeah.
infection, i.e., thrush, but natural remedies, I'm not sure they will treat it. They
Actually,
will,
yeah. The reason why I'm laughing is because
yeah,
I've heard that as well. Like, you know,
yeah,
some people they they use Greek yogurt.
yes,
So they either take it or they apply it around like the vaginal area. They said this creates like a good environment.
meant. Hmm. So you have cottage cheese, you use yogurt, you kill fire with fire.
Listen,
Okay.
I have heard of that. That's what some
No, I
people
have actually,
use.
yeah.
Yeah,
I have as
honestly,
well.
they said it helps. Like, I don't know, I can't be a testament to that. I haven't used it, like, but
No.
I have heard like a lot of people say, oh yeah, Greek yogurt is really good. You know, it provides a good environment for your vaginal area, you know, just to help prevent like thrush and also help cure it. And I was like, oh, okay. I see. I mean, there could be some sort of truth in it because you know the Greek yogurt it contains like live bacteria or something like that. So
Hmm. But this
you
is what I
know,
always say when it comes to things like that, Steph. Like
yeah.
that is a very, very intimate area.
No.
Keep it plain, okay? Don't do too much down there. You know, all these perfumed soaps and all of that.
Mm.
Don't like you're trying to make it fresh. You know, it's Valentine's Day, you're trying to make it fresh. Don't, like some of these things actually what is going to
Yeah,
cause complications, what's
that's
going to
right.
cause some of these conditions. So I understand, you know, live
Mm.
bacteria in the yogurt. So yes, if you really look at it, you're like, yeah, that could, yeah, I see how that could be, yeah, working. But it is an area where literally just some nice warm water
Well,
would do good
that's it.
cleaning. Just warm water,
Yes,
cleaning nicely, you know, that's all you need. All these
that's
other
it.
things, I don't know. I can't really I can't just put a stamp on that because I especially because do you know what, any other thing when you have your onion when you have a cold step that I can go with,
You're
but
not gonna let me
yogurt
live with this?
no. But yogurt for vaginal thrush, I have questions.
Yeah, yeah. And you know what? People come up with like, a lot of things. It may work for them, it may not work for you. So each to their own. Do what what is suitable for you. Yeah.
Yeah, no, definitely. We're just here to provide guidance, to provide some information. But if you've done anything and it has worked for you, listen, if you come to me, I'm still going to give you the same guidance I'm giving. But if it's worked for you, do you.
That's right.
Now, whilst talking about this, let's just talk about some of the things that we can do if you have vaginal thrush, just to ease the discomfort or even prevent recurrence.
Yes, I think that's quite important. Preventing the thrush is like the main thing, you know. I'm not sure if you did listen, like as I said, with the yeast, that yeast, it normally exists in the bowel and in the genital area. So one thing that one good practice that you could do is wipe from like your bottom. So when you're wiping your bottom, wipe from like front to back after going to the toilet, because you don't want to wipe from like the back to the front and maybe move like the yeast to the vaginal area. Yes.
You know the little pieces
that's
left there.
You never know what kind of practices people do, but this is like really important. If you wipe from like front to back, it's a lot more hygienic, which prevents like the spread of this the yeast infection. So if you're doing from anus to vagina, no, it's vagina to the anus, please. Okay.
And I think it's very important that when people are having children, do teach them how to do some of these things. So I know like there's potty training and all of these things. Now, I don't know if everyone practices it, but I know that I 100% will. And with my nephews, they know it's from front to back, okay? From the front, to, like you pass by the anus, but you don't start with the anus. No. So it is, I think, something that going forward as humans, guys, let's just teach some of this to our children. They need to know, because you know, like habits are formed from a very young age. So if you're just constantly, like if you're so used to, oh, I'm just gonna, you know, you don't realize like, okay, actually you're not doing yourself any good doing some of these things.
Yeah. Another thing we normally advise is that avoid using soap to wash like the genital area. As Trudy mentioned, water.
Yeah.
You know, plain warm water will do the trick. Yeah. Maybe you can use soap substitutes. Like I'm not sure if you like, some people use E45. Like this is quite safe. Yeah, this is quite safe, which you can use. As Trudy mentioned as well, avoid these perfume sprays. You know,
Valentine's Day.
Listen, our genital area, it has a natural smell. Let it smell.
Let it smell. It's natural.
Honestly,
it is normal. It's natural.
Yeah, like all these feminine hygiene products, honestly, they upset the area, and that's what causes you to have these thrush, because it increases like it just spoils like the environment of that area, and which increases like the yeast production. So it's best, as we said, normal water, wash that area, avoid this perfume sprays and stuff. Honestly, even like toilet papers that contains like perfume and stuff, they could also irritate like the area. Yeah, even menstrual pads that contains perfume, it's best to avoid that. Just go for normal ones with no perfume. Honestly, it will do the trick. These will help you prevent you from having thrush. Also, I heard one thing that I used to also get advice on is to avoid wearing like tight fitting pants.
Yes.
And wear some loose pants.
Cotton pants. Loose cotton pants. Oh,
honestly, these will help you. Like as much as like we're like, having a laugh about it,
it's
yeah,
yeah,
it is actually quite effective. You know,
it is.
wearing tight fit pants, it does not help at all. It does
No.
not help. Um, w- as we mentioned earlier, there are some medications as well which can cause like you from having thrush. Let's say,
Mm,
for instance, you are someone that that takes antibiotics a lot. You may find that maybe you're getting thrush a lot because antibiotics can cause you to have thrush. So maybe you may want to reduce the frequency of you like taking these antibiotics. If it's not
yeah,
needed, do not take it. So always make sure you seek advice from your GP. You know, if you are on these antibiotics, make sure
yeah.
that you need to be, it is something that you need to be on. Yeah. Um, let's see, what else can you do to
I,
prevent?
I think drying properly as well when you've washed.
Oh,
So drying
yes,
properly, and I think that's a problem we have because
that's right.
I tell you what, I think the problem we have is this, and this I'm sure a lot of people do, and it's a problem. When you have
Yeah.
one towel for the face, for the body, for the
Oh, yes.
no, 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 no. Because what happens is you try not to wipe down there and then wipe your face, right? So you
Yes,
don't end up drying your vagina properly.
that's
Now that
right.
is a problem because that could actually cause thrush because
Yes,
this candida likes sort of moist areas. Like thrush happens in a lot of moist areas, so you leave
that's right.
that area moist, you're basically not doing yourself any favors. So
Mm.
not drying properly is a really big problem, and I think people need to have 3 towels in their bathrooms: one for the face, one for the body, and one for down there, and maybe have it like I don't know, right? Front and back. I don't know. But something needs to be done here. But I know for sure that
Yes,
people who come to pharmacy and they have this as a recurrent thing, one thing I
yeah.
always ask, and maybe they take it I don't know, they take offense in my questioning, but I'm just trying to really be sure here and I'm trying to
Mm.
help. But I always ask, do you dry properly after washing?
Mm.
And a lot of times they say, yeah, of course I dry properly. But you're properly, is it properly? Are you leaving that place nice and is it, is it
Yes,
nice and dry? Because that is one thing that could really, really cause discomfort during thrush, but also prevent reoccurrence of thrush.
that's right.
As well as we
That's
said
right.
before, just keeping the area clean and
That's
dry.
right. Oh, that's right.
Keep it nice and clean, and you're
Mm.
good to go.
Mm-hmm.
That's the
Brilliant.
Garden of Eden. Keep it nice and clean.
Yes, yes. I like that. Garden of Eden.
Garden of Eden. But also one
Yes.
thing is, I think this is something that I read on, and I actually do tell my patients.
Mm.
Um, maybe it's just a comfort measure, but for say oral thrush, if you avoid spicy and hot foods,
Okay.
and also maintaining a good oral hygiene, it will really help. So I know we're talking mainly about vaginal thrush, but it's just good to
Mm.
mention that if you say have oral thrush, it's very important just to avoid spicy and hot food because that will just irritate sort
Yeah,
of the mouth and the throat, and it's not gonna help with sort of just healing and treatment of oral thrush.
okay. Okay.
Yeah,
Brilliant. I think we've touched on this, like recurrent thrush. So there are some people who get like recurrent thrush.
yeah.
So this is when, let's say, for instance, they've had 4 or more episodes of thrush in a year.
Mhm.
As I mentioned, like, my relative, yeah, was having like thrush like crazy.
Mhm.
And sometimes she may use like the antifungal creams and
Mhm.
it, like, she'll be complaining that it's still not gone. So
Mm.
there are some people where they get thrush a lot. So Trudy, how would they manage the recurrent vaginal thrush?
So to start with, how I always advise patients is, if say if you've used over-the-counter treatments like things like clotrimazole for more than, say, for the 14 days. That's it. Don't use more than 14 days.
Yeah.
Unless, of course, the doctor tells you to, or you've got the advice to do so. Because what happens is the fungal infection can become resistant, and so the medication will stop working. So you could have recurrent thrush after this, after you've used it for more than 14 days. So you used it, I don't know, a month, just because it was, for comfort purposes, right? And after this period of time, you get thrush again. What could happen is the next time you have thrush, you could have your body could be resistant to this treatment. So first of all, it's not ever recommended to use it for more than the period that that has been suggested, unless you speak to a healthcare provider. So if you feel like after 14 days you still have the symptoms, stop the treatment you bought over the counter, go to the pharmacy, who will more than likely signpost you to your doctor. So go to the doctors. There might be an underlying cause. So that would be the first thing, right?
Yeah.
Now, and of course, if you suspect you have thrush or thrush experience of thrush symptoms, it is very, very important to just consult your doctor or your pharmacist for treatment. And for recurrent thrush, there is treatments that people can use actually on a regular basis. So we're not saying that recurrent thrush is abnormal. No, it actually is not abnormal. It can happen. But if you're having recurrent thrush, so you're having more than 4 episodes of thrush in a year, don't go for any more over-the-counter medication. Go to your doctor or your pharmacist, who in this case will pretty much signpost you to your doctor. There could be treatment that you can take on a regular basis just to prevent a recurring thrush. So a recurrent thrush, as we said, could be maybe because of some of these things, diabetes, or maybe some of these medications you're using, things like that. So it's something that, because of it's medication you're taking all the time, or it's a condition that's occurring all the time, the yeast will overgrow anyway, so you will have recurrent thrush. So in this case, go to your doctor. There is treatment. There is definitely treatment that you can use on a regular basis for recurrent thrush, but speak to your doctor.
That's right. That's right. And I think it's worth noting that with the recurrent thrush, don't expect that you're just going to get like a one-off medication and that's it. You're treated. It does take at least about 6 months.
6 months.
So you will be on treatment for about 6 months. So just to prepare yourself, it's not something that, they just give you one medication, that's it. Your recurrent thrush is gone. Be prepared to take it for about 6 months. Okay.
But the good thing with something like that is the doctor will see what options there is. So there could be an option of, okay, maybe we need to change your medication, maybe we need to go on this a different direction. But in this, like, of course, during this period when that is happening, you will have treatment for that anyway. But as we said, always, if it's been more than 4 episodes in a year, go to your doctor. Speak to your doctor and see, first of all, what is the underlying cause, and secondly, what is the correct treatment for you. One question I have for you, Stephanie.
Okay.
Thrush and breastfeeding. Now, first of all, thrush and pregnancy. How do we go about that? Say a pregnant woman comes into pharmacy to get over-the-counter medication for thrush. How are we going on about that?
Okay. So I'm glad that you mentioned that. Thrush is actually quite common in pregnancy, and some people that don't actually didn't know that. It's actually quite common because in pregnancy, your hormones are a bit imbalanced, or they're all over the place. So which can make you prone to getting thrush. I normally, if you are pregnant, I would signpost you to your doctor to actually go for treatment, because you are pregnant, you are carrying a fetus in you. So
Yeah.
we need to check that the medications is not going to affect the baby,
Yeah.
So if you are someone that is pregnant and you are getting like these symptoms and you feel that it is thrush, you could by all means go to your local chemist, but they will
Mm-hmm.
signpost you to your doctor for some treatment.
Yeah.
There are treatments, of course, but it's best to go to your doctor so that they'll check that yes, it is thrush that you have,
Mm-hmm.
so that they could take the right precautions. Yeah,
That's right.
yeah.
And when it
Um,
comes to breastfeeding, we know that a lot of women come into pharmacy, they've had the baby,
mm,
they're no longer pregnant. They're like, look, I've had the baby now. But again, I keep getting thrush, or I have
mm.
got an episode of thrush. Can I use medication for thrush whilst breastfeeding?
Yeah, so with that, we may have to check because there's some medications that actually it does get into the milk.
Mm-hmm.
So we will have to check that one. I'm not sure which one it is, but I think the tablets may be
Yeah.
excreted in the milk. So it's best to avoid that one.
Mm-hmm.
Um,
So
bear
I
with me.
think the pessaries creams, internal and external, those are safe for breastfeeding. So they're not
Yes,
they're unlikely to get into
yeah.
breastfeeding. Yes.
But with the tablets, yeah, those ones we normally avoid. Yeah.
Yes. Unless of course
Okay.
you've been signposted to your doctor and they have recommended that
Yes.
by all means.
Yes.
But what I'd advise is whilst using say clotrimazole or thrush creams, because you have applied the cream, but what I'd advise is just wash your hands, regardless of whether you're
Yes.
breastfeeding or not. Just wash your hands after using them. Or in the case of say in the case of a woman who's breastfeeding before picking up your baby,
Mm,
because there is still there is some of that cream on your hand, which
mm.
might cause say some irritation on the baby, but you also don't know what you're passing on over to your baby.
Yes.
So it's always very, very highly recommended that once you've used these creams, first of all, wash your hands before you use these creams, guys. Okay,
Mm,
don't eat your sauce, put your fingers in your sauce, and then you get the cream and you're putting the cream. No, you're not
mm.
doing yourself any favors here. So wash your hands before using any of these creams, and then use the cream, but wash your hands after using the creams.
Yes.
And in the case of a say breastfeeding baby, I always say if you have any concerns about the baby, talk to your doctor or even the
Yes.
pharmacist. There is also health visitors, so speak to them about this.
Mm. Okay.
One last myth before anything, before I forget, if anything, I've
Yes.
heard women say that medication for thrush can affect fertility. Have you had this, Steph?
Yeah. You know what? We always like touch on like fertility and stuff because
Yeah,
people always want to assume
yeah,
like some medications are affecting their fertility or causing
hmm
some fertility issues.
yeah.
There's no evidence
No,
that has shown that these medication are causing any fertility issues.
no.
So I'm sorry, no, it does not affect your fertility. Um, these are known to actually prevent you from having thrush and cure the thrush, but no, it will not affect your genital area in any way. It will not affect your hormones in any way. It's not gonna cause any fertility issues. So that
No,
is one thing. Yeah, we need to scrap that. Yeah.
definitely. Like, if you're not
Yeah.
sure, don't Google. Go to your
Yes.
pharmacist or your doctor, because
Yes.
there's a lot on the internet as well. So when you start Googling, can this cause for? There'll be someone who's just put up something and they've said, "Yeah, my wife used this, and now we can't." No, 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 no. Don't read too much
Yes.
into sort of these blogs and on wherever
Mm.
there is out. Just be very careful on the information you feed yourself.
Yeah.
If you're not sure about the information out
Yeah.
there, always go to your pharmacist or your doctor. That will be the safest way to go.
Hmm.
So, what is your
Brilliant.
take home message in regards to thrush?
Okay. My take home message is I will start off with the young girls. Thrush is not something that, we need to be ashamed of, or
No.
it's not a no condition. Like it is so common, as Trina mentioned. It occurs to about 75% of women. So it's so common. It's something that we need to just become accustomed to it. That this is normal. This is normal. It does happen to a lot of us. You just need to recognize the symptoms when you do have it, and do speak to your local chemist about it. I think people need to stop associating thrush with like being a sexual disease. Being a sexual disease. It is just a common yeast infection that occurs to us, to anybody. As we mentioned earlier, avoid these perfumes. Try to make your Garden of Eden, as Trina mentioned, smell a bit fragrant. So please, let's stop that. Help yourself by just using normal water to wash down there if you need to. In terms of like the medications as well, make sure that you speak to your pharmacist so that they'll provide you with the right advice. If you're someone that you keep using the medication over and over and over again, this is something that maybe you need to come into terms with. Like, no, I've been using this for too long. There is something else going on. Let me go see my doctor. Because there are some people there, let's say they just go to the local chemist, just pick up like a cream, and then you pick up a cream like every single time without even speaking to someone about it. But then you need to come to terms, no, I've been having this thing too often. Maybe it's time I speak to my doctor about it and actually find out what is going on, because there could be an underlying issue there if you are getting it that often. So my take home message also, what's your diet? As we mentioned, if you're someone that eats a lot of sweets and stuff, that could be the cause of it. Yeah. So what's your diet? Obviously good hygiene as well would help prevent you from having the thrush. And if you have any concerns, speak to your doctor.
That's it.
Yeah. What would be your take home message, Trudy?
So if you recognize the symptoms of thrush and you seek prompt medical advice and you get the right treatment, you're basically on the right path to effective management of thrush. So these three are very crucial. Just recognize the correct symptoms, seek prompt medical advice, and get correct treatment. Because we are aware that when it comes to, say, the women area, when it comes to, say, discharge, there's a lot of different kinds which could indicate different conditions. So just get the right treatment for the right condition. And this will be crucial to effective management of thrush. Now, we've talked about good hygiene literally all through. So good hygiene practices, lifestyle adjustments, which is what we've talked about again and again. So cutting down on the high sugar diet. So you don't want white, keep off the sugars,
Yes.
And also just addressing any underlying health conditions would be very crucial in preventing recurrent episodes of thrush. So if you suspect that you have thrush, consult a healthcare professional for accurate diagnosis and also an accurate consultation. And remember, you are not alone.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.